Hello, I'm Melissa Ambers, located in Houston, Texas. Today we're going to be talking about the invisible diagnostic. We spend over a decade mastering the clinical variables of medicine to keep patients safe. But there's a solid diagnostic test happening right now that most physicians are completely failing. It's not happening in your clinic, it's happening in what's called the digital streets. Today, we're talking about the invisible diagnostic and how your public profile dictates whether your patients trust you before they even shake your hand. The patient's journey is structurally changed. It doesn't start in your waiting room anymore, it starts with the discovery phase. And that discovery phase is online. This is how patients look you up to see who you are and understand how you have been taking care of your patients and how you're showing up as an expert online. The diagnostic, the patient is quietly evaluating your care signals. If you pass this digital check, the consultation and treatment compliance follow natural because trust has already been established before they even come to your office. Let's look at the hard data. 85% of your patients are pre consulting your digital profile before their appointment to evaluate your authority and cultural fit. When you are a digital ghost, you create a 15% trust gap, according to research published by the BMG Open. Patients' experience is directly tied to the clinical effectiveness and safety. If they don't trust your profile, why would they trust your treatment plan? With this graph, you're going to also see the percentages of digital trust once you are online and they understand who you are as a person, as a brand, not only that you're located at a specific doctor's office. Now, let's get into the clinical prognosis. First, your digital identity is preventative medicine. Strategic branding is the invisible diagnostic that determines a patient's receptiveness before a single word is ever spoken. You routinely practice preventative care for your patients. It's time to practice for your professional reputation. Second, we have bridged the trust gap. Managing your digital presence must be viewed as a formal clinical variable. When a profile is unverified or poor, it introduces a risk. Actively managing your digital narrative. Compliance because the skepticism has already been cleared away. Third is about scaling your impact. True expertise shouldn't confine to a single geographic clinic, but deploying a structured framework, high level specialists can project their unique clinical authority across global health markets, breaking down traditional borders and expanding your professional footprint. Finally, we must future proof our care. As technology and humanity coverage, trust is the ultimate currency that assures your medical innovations are actually adopted by patients. When patients trust your brand before they meet you, they effectively pre diagnose how ready you are for them. Here's a quote that, I came across and I put it together, to help kind of understand where a patient trust is with your brand. When a patient trusts your brand before they meet you, they are effectively pre-diagnosed with readiness for care. Here is the framework, the care framework that I put together to help outline and show how patients look at you online when they are researching you, not researching your clinic, but researching you. This is the care framework. C is clinical authority, curating digital, proof of expertise. Yes, there is such a thing as called digital expertise. It's more than just your CV. The R is reputation equity, managing peer endorsements and professional quality signals. A is accessibility, using your bio to reduce patient pre-visit anxiety. E is engagement, using the social media stethoscope to share knowledge and drive long-term adherence. Now, really quick, I want each and every one of you to pull out your phone, your iPad, or the next digital device that's sitting right next to you, put in your name and Google yourself. See what is coming up, what is popping up about you. Um, are you giving away your patients to your competitors because you don't have that digital footprint? And it's more than just your doctor care and your history, your accolades, and everything that you have been recognized for. In today's world, we're looking for that digital footprint to ease the anxiety, to ease the care that I know that I'm going to get from you. So I'm leaving you with a diagnosis and no treatment plan. I'm not going to leave you with a diagnosis and no treatment plan. On your screen is your digital health prescription. Scan this QR code right now to download a step-by-step PDF. It is a tool that was built for you for the time poor physician to bridge the gap between clinic and the keyboard. Don't leave your reputation to chance. If you want the ultimate blueprint to master these digital streets, my book, Hustle and Flow, is your roadmap. You spent years mastering medicine. It's time to master the platform that brings patients to you. Scan the QR code to claim your copy directly on Amazon. For those of you that want to expand further into the organizational change, strategic synergy, and navigating the future of AI in the workplace, you can order the full protocol to practice your library. Now, by scanning this QR code, you have open access to my authors page, which you can get each and every one of these books, and including additional books that I have authored. Thank you so much for your time, and I hope you found this presentation to be valuable, and I look forward to Googling you